Hi, everyone. We're about to take off in 1 minute, so I just wanted to hop on and tell everybody thank you for joining our webinar. This is the first of many, and I think this is so important because it's just information that's out there that a lot of people don't are not aware about. So we're going to start in just 30 seconds, and we're going to hop everyone on in. Hi, everyone. Okay, thumbs up, we start. So let's really begin. And this is really about from fear to facts. I thought this was so important. Every day I get questions from both my colleagues and patients whether this is the right treatment for them. Is bioidentical hormones the right one? Are they scared of this? What happened in the past? So we're going to dive into this scenario and really figure out what happened in the last 2 decades that made people fearful and where we need to move forward to keep women safe. So this is me with bangs. What do you think? So I think what's really important about this is, if you don't know me, I'm Dr. Yvette Suarez. I actually originally did my residency in pediatrics and emergency medicine, and I practiced there for 10 years. And then I'm the founder of Bella, and we've been open now for 20 years. I think what's super important is about 10 years ago, I went and did an anti-aging fellowship in functional medicine. There was so much misinformation out there that I thought it was so important for me to continue to educate myself while I'm seeing patients. And I don't know if you know this. However, when you're in med school, we probably get about 12 hours of education on hormones. It's really not a thing, it's pretty much treat it with this. Here's some birth control, let women age, let them go in menopause, and not really have to treat it. I think over the last 10 to 20 years, we really understand now how important functional medicine is and how important bioidentical hormones is. And so always remember that when you are seeking out counsel, and I know there's people on this call that are not from Florida, is just make sure that they are fellowship trained, that they do have information, that they're not just practicing in the dark, because this is medication that is going to improve your health. And so, why does this conversation matter right now? Well, I personally think it mattered forever, but why is it coming to light right now? So, I think it's important to understand that hormones are not just about hot flashes. I think that's the first time that people start to inquire about bioidentical hormones is when they start to feel that heat and that night sweats that are just absolutely horrendous. But really, what have been women have been told for the last 20 years? We were told it causes breast cancer. It causes heart disease. It causes dementia. So I'm sure that women are confused. They don't know. They haven't been offered hormones. They've been afraid to ask about them. So we're going to dive in of what happened and where you should be at now. So in 2002, this is what started it all. The Women's Health Initiative changed everything. They literally had a study that scared everyone. And at that time, about almost 75% of the women that were on bioidentical hormones came off. They were so afraid by this study. And it took us 20 years to admit that they were wrong, that the study was flawed, that actually what they said was in the study was not true. And this became an evolving thing, which was what was really, really scary to me, was that we didn't take a step back and say, this study was wrong. We all read it. We knew the conclusion was not accurate, but yet the hysteria continued in the media and it really filtered into every woman's home and every woman's heart and just showed fear. So, what was the fear? Let's go back. The study actually had an average age of women at 63. We know that perimenopause really starts late 30s to early 40s, yet we're starting a study at age 63. Many of these women were at least 10 to 20 years post menopause. Okay. So we know that the most correction that you can have for symptoms are going to be within those first 10 years. The hormones that were also used were not bioidentical. So we're going to break down what does it mean to have bioidentical hormones and synthetic hormones. But I think the biggest thing is just to say it's no longer okay to just say just suffer because you're getting old. I never want to hear that again. So In November 2025, so just the other day, the FDA officially removed the major black box warning on both estrogen and progesterone. This should have been corrected 20 years ago. We at Bella have been educating and treating women and men with bioidentical hormones for over a decade. We knew this was important. We were trying to prevent disease, but fighting all of the hysteria regarding this one bad study. So, what does it mean between bioidentical and synthetic? And I understand this gets really, really confusing, but not all hormones are the same. You start looking at back in the day what kind of hormones they have versus what they have now. And we're going to break that down because I think you'll be surprised on how hormones were originally processed to be put into a woman's body. So when you think of bioidentical hormone, think of it as a key in a lock. It needs to fit at that perfect structure. So like a receptor, the key would go into the lock and turn, and it fits perfectly in there. So when you have that perfect combination, you're going to have improved control. You're going to have improved symptoms. It's going to be very natural signaling, not overpowering that. So where other synthetic hormones will sit on there and overstimulate those receptors over and over again, you're going to have with bioidentical very improved balance. You're going to have good benefits and very little to no side effects. Where with synthetic, when you're overstimulating that pathway, many times it starts to go down the wrong path. Oops, and I'm so sorry, I have not been on camera. It starts going down the wrong pathway, and that is not okay. So you might be going to the left or to the right versus straight down to those receptors where you need it. And so these will trigger significant side effects. So what is better? When you hit the receptors, you'd be shocked. And I think this is one of my favorite slides is to understand where bioidentical hormones actually improve the system. So if you think about it, we always think hormones, we think we're protecting the uterus and the breast, right? And that's it, because those are our areas that are going to be for OBGYN. To me, it's so important for you to understand that the hormones work in every part of our body. It works in our brain, it works in our heart, it works in our bones, it works on our blood vessels, and then, of course, the breast and uterus. So, again, this is so important because no one thinks like that. We think, why are we getting foggy, right? It affects every part of our body. And I hear that from women every day, and they'll say to me, why do I need progesterone? I don't have a uterus. Or why do I need this? I'm already in menopause. Because it affects our entire being. So, really important to move that on. So what actually happened in that study was they also used what's called Premarin. So if you're older like me, you'll remember back in the day, Premarin was the thing. It was what was given for women for estrogen. It is, if you look at the word Premarin, it's actually pregnant mare, so pregnant horse urine, and that's how estrogen was being taken. And so you were getting a huge dose of this estrogen that would sit on this receptor and overstimulate it for weeks versus hours. Then you have Provera, which was synthetic progestin. And I'm going to explain to you the difference between progestin and progesterone because progesterone is so important for our body and so safe, and progestin is not. But this is what was being given back in the day. That's really what they had. They didn't really have bioidentical hormones, which we have now. And so we're so protective. Many of those women that study also had already cardiovascular disease. But despite all that, despite all the badness in that study, it still revealed important things. It revealed that there was still a lower all-cause mortality, even with bad hormones. It also caused better cardiovascular outcomes. And then with the estrogen arm means that they only got estrogen during their treatment, no progesterone, no testosterone, and it still improved lower breast cancer mortality. So even with a study that was so flawed, it still showed optimistic results, yet the media said it caused cancer and it was taken off the market. So the FDA update. So what changed? They finally looked at all the studies, which have been hundreds and hundreds of studies that now show that bioidentical hormones improves cardiovascular disease, improves dementia, and improves breast cancer. So I don't know if you know, but the number one reason that both men and women die, the number one reason is heart disease, heart attacks. So if we have something like this that can improve it, why are we not taking advantage of that? It's also really important to understand when to start. We're going to talk about a little bit about perimenopause, late menopause, early menopause, but really important to start the earlier the better, at least before 60 if we can, and within less than 10 years of menopause. Now, that is starting to change a little bit. We know that we can start treating with bioidentical hormones at any age. I have women coming in at 70 starting. I think the difference is when we're trying to prevent long-term disease. If I am trying to prevent you from becoming hypertensive and having a heart attack and having osteoporosis, the earlier I can start, the better benefit you're going to have. If I am now treating you with bioidentical hormones 15, 20 years after menopause, you already likely have a lot of these diseases either chronically or at least beginning. So the earlier we can start, the better. In perimenopause, which I think is the hardest time to treat, and when women feel like they don't really need to be treated, this is when they become most symptomatic. So perimenopause, as you know, is right before, probably a good 10 years before full menopause. So it's usually throughout your all of your 40s. I have some women that I see that already have started in their 30s, and that's when we're getting these big swings, right? And so you'll start having acne, you'll start having weight gain, you'll start feeling foggy, you'll start having anxiety, depression. This is because your hormones are starting to swing one way or another, especially the estrogen fluctuations. But what I've noticed is most women first start to decrease their testosterone. And so they'll start to have that brain fog. They'll start to have decreased libido. They're exhausted. They're putting on a couple of pounds. So they don't really start to think about that as menopause. And then at that perimenopause, early menopause, they'll start to have that I can't sleep really well. I can't fall asleep. I can't stay asleep. And then I think with the late menopause is where everybody then becomes in a panic because now they feel terrible. They're at their wits' end and they're having hot flashes, they're having night sweats, they can't sleep, and that's when they're starting to come in. So imagine if we can start to treat that a little bit earlier on before you feel your worst. And so it's really important. We do a podcast called Bella Beyond Beauty, and one of our last guests was talking about how she was so depressed, crying, and she was at her wit's end. She just felt like she couldn't go on. And once we supported her and corrected her hormones, to see how happy she is in such a short period of time really validates what we do to make women feel empowered again, to take control that you don't have to feel your worst all the time. So, how does the hormone protect the brain, the heart, and the bones? So, I wanted to kind of break down each hormone because I think sometimes they're a little confusing. So, for example, estrogen, and we know that by estradiol is actually the main estrogen that's going to bind to your receptors. There's three types of estrogen. And so in the brain, it's going to improve your blood flow. So better focus, better memory, better energy. It's going to support your neurotransmitters, less depression, less anxiety. It's going to help protect your memory and cognition. And then in your heart, it's going to keep your vessels flexible. So what does that mean? That means you have less risk of hypertension, less risk of high blood pressure. It's going to support your cholesterol. It's going to improve and decrease cardiovascular disease. For the bones, we know osteoporosis is a big thing. Almost everybody's osteopenic by the time they're in their 40s, which means you're starting to break down that bone and not build extra bone. We need to protect our bone. We need to protect our muscles so that we don't have fractures as we age, that we don't have to have a walker as we age, that we're able to stand up from a sitting position and feel youthful. So what is progesterone? Here's one of my pet peeves. I'm gonna have a few that I'm gonna talk to you about, but progesterone really helps with sleep and anxiety. So think about it has a GABA effect. It keeps us calm. It keeps us less moody. So it stabilizes our hormones, not only protecting our bone. So you'll notice a lot, I'll hear from patients saying, I sometimes hear myself and I don't even like myself, or I snap so easily. I'm so much meaner than I used to be. We start to lose that calming effect. Okay. And so what normally happens when this is one of my biggest pet peeves is you get close to menopause or you're in perimenopause and you go see your doctor and you're like, I can't stop crying, or I'm really angry and sad all the time. I feel depressed. I feel anxious. And I know they mean well, and these are my colleagues, and I really hope that we, as we continue to grow together, that we start to look at things a little differently, because the first thing they'll give our female patients is an antidepressant and an anti-anxiety drug, which we know is harmful. We know it causes dementia. We know it's addictive. It doesn't necessarily treat the disease. And so we're just putting a band-aid on so that, okay, here, take this stuff. It'll, in 3 months, it'll start to work a little bit, and you'll probably feel better 30%. When we have something that we've had our entire lives, progesterone, that can kind of help us out immediately. So we need to keep getting the word out and really help everybody understand that. Now, testosterone is my favorite hormone. I always tell people if I could sprinkle a little testosterone on everyone, we would have a happier world. Men would be happier, women would be happier. It is my feel good drug. It is not just for men. Now, men do have tenfold what we have, for sure. They have tremendous amount of testosterone, but we do too. And when we lose our testosterone, we lose our motivation. We feel less confident. We become foggy. We start to lose our muscle mass. We get really flabby as we get older and we start to put on that little weight. We start to be really uninterested in sex and taking care of ourselves. We start to feel a little anxious. Our hair starts to thin out. And so these are all things that women don't really think about. And we blame everything else, stress, our lives, our busyness, but we don't think about how important testosterone is. So why balancing all three important? Now, we've talked about all of these. And look at that. I want to feel like myself again. I want to feel like I'm 35 forever. So in the aesthetic profession, my goal is always, I tell people we need to look younger, as 10 to 15 years younger than what we are. I tell people I want to look in 35 to 40 forever. But I also want to feel good in the inside. I need to feel clearer. I need to, not put on all that weight. I need to feel stronger. I want to go to the gym and actually see improvement. When I'm not on the hormones, you can go to the gym, work out all you want, and you hit a wall. You don't see any changes. And it's so frustrating for women that they're not eating. They get no protein because they're fasting all day long. They're getting flabby, they're getting skinny, but they still have all this extra fat. That is not what we need. We need to be healthier. We need to eat healthier. We need to improve ourselves with hormones. And so we don't need to starve ourselves and we don't need to be sad. We need to be powerful. And this is how we get there. So, long-term protection, again, one of my favorite things. It's okay to want to feel amazing. I love that. It's okay to want to look amazing. I love that. But I need to prevent disease, right? We need to live longer, but with quality of life, not just quantity. So look at these numbers. These are even better than most medications that Big Pharma will give you. We know that bioidentical hormones decreases up to 35% of dementia and Alzheimer's, up to 50% of fractures, up to 40% of heart events, and decreases the risk of mortality by 30%. I have never seen better numbers than this with any kind of antidepressant, anti-anxiety drug, any medication they give you, these numbers that are completely natural to what we've had our entire life. What a change that would make for us. So remember, in perimenopause, again, you're going to start with that fogginess, some sleep issues. You're going to feel a little anxiety, right? You're going to start to feel a little more anxious. A lot of women get really severe PMS worsening, pain, extra bleeding, feeling exhausted, becoming anemic. Those are all kind of starting in the perimenopause symptoms. And then during menopause and postmenopause is when you really see that I just don't have any libido anymore. I don't have any energy to go work out. I'm exhausted. I'm not even tolerant of my kids and husband anymore. Women will get palpitations. It's interesting how many women I see get that and they get a full cardiac workup, But they never really understand that a lot of times that is from just loss of hormones. And then once we treat that, those palpitations will go away. So remember, this is not normal aging and it could be treated by your hormones. So let me move over here. So in perimenopause, this is the opportunity that I think most people need to think about. Now, it's not to say that everyone needs hormones in perimenopause. We have plenty of people that come in, and if we can optimize their vitamins, if we can optimize their minerals, we can optimize their thyroid, we can get them to a better place and kind of reboot their system. But when you're completely diminished, you are not going to make more hormones as we age. Women always tell me, well, maybe next year it'll rebalance. Well, after you've depleted everything, it's really hard to get that back. And so we really need to work hard in improving our adrenals and improving our DHEA to kind of help reboot that system to make sure that we don't continue to worsen as we go. So this was, I think, a really big deal. We talked a little bit about progestin early and Provera. And so think about, and we're going to talk about birth control in a minute because I think that is really, really important. And I'll explain why. But for example, progestin is in birth control. Progestin is what synthetic progesterone is. The problem is it mimics the receptors. So progestin will bind to progesterone receptors. Great. The problem is when it binds, it blocks that so that we decrease ovulation and it completely suppresses your periods. It suppresses all hormones. And so what's happening is you're not getting that hormone control. You're not getting all the good results and the good benefits that are going to be coming from hormones. Instead, progesterone sits on that receptor, completely blocks it. And so now you really truly have lack of progesterone because the progesterone can no longer bind to those receptors. So you'll start to see younger girls being a lot moodier now. They're having more problems with anxiety. They're having more problems with depression. They're not being able to sleep. And nobody's taking a step back and looking at these girls are being on birth control for a really long time. We're seeing increase in fertility. And why? We've been suppressed forever. And look, I'm in my 50s now. I was on birth control for a good 10 years when I was younger, right? I was birth control in college, in med school, in residency, right? I couldn't afford to get pregnant. We need to look at better ways and ways, there are ways now that you can have birth control without necessarily being hormonally suppressed. And so I think this is important. We're not just looking at women over 50. We need to make sure that we're supporting all of these young ladies. I'm supporting my daughter who's in her 20s. I want to make sure that I am decreasing all of this risk as we go on. And I think that's all about prevention. It's not just to make us feel better when we're older. So, really quick, birth control versus bioidentical hormones. You're going to see here, I've had this happen recently a few times, so I just wanted to quickly go over that. Birth control is not a treatment for menopause. If your doctor is putting you on birth control at 50, we have a problem. Okay, you're suppressing all your normal hormones already that you don't have. We're supposed to be rebalancing ourselves, and now we're having side effects. And then you do have with birth control, because it's progestin and because it's synthetic estrogen, you are going to have a higher risk of blood clots and a higher risk of heart disease risk. So we really need to make sure that you take control of your health and ask the right questions. Is there something better I could be on than birth control as I age? And I'm sorry, I'm very passionate about that, but it just, we need to change the narrative. So again, I wrote here's the symptoms that happen with birth control and perimenopause. Okay. You're still in your 40s. You're taking birth control. You have an increased risk of blood clots. You get higher blood pressure. You start to become insulin resistant, which we already have a problem with insulin resistance and diabetes in this country. We start to notice our cholesterol is going up. We're all inflamed. We don't understand why our inflammatory markers are all elevated. We're not protecting our bone. Yet nobody talks about this. It's really easy to give a prescription. And what I hear all the time is, oh, my doctor gave me this prescription, but they say it's small amount of hormones in there, small amount of synthetic hormones that still block you from making your own hormones. That still doesn't make sense to me. So again, we're bioidentical hormones. We're going to go next and talk about this sits in your synapses. It goes on your receptors, perfectly binds to that, and acts like your real estrogen and your real progesterone that is made by your ovaries. We need to replace with what is identical to what our body expects and recognizes. And so quickly, just a couple of forms of bioidentical hormone is there's the most common kind are going to be topical preparations. Then you're going to have the injectable kind, and then you're going to have pellets. Those are probably the most common. I think when you see your OBGYN, they normally give you a patch. A patch does not have testosterone in it. And that's because that's about the only thing that big pharma will give you. And you just have to make sure that they're bioidentical hormones. They're kind of hard to absorb. You kind of have, not a really good ebb and flow. They're not really well stimulated, but it's really important just to be treated. And when you come in, this needs to look at what's best for you, depending on your age, depending on convenience. And so we'll kind of go through that a little bit. And then bioidentical hormones, again, we're going to prevent disease. We're going to support our brain, our bone, our heart, and our metabolism. So when someone says, why do you need bioidentical hormones? And it's not just to say, I don't have my period anymore and I'm sweating at night. You're going to say, I need to think clearer. I need to protect my heart. I need to protect my bones. And I need to always improve my metabolism because nobody likes to gain that 15-pound menopause weight. We all did that. And so one of the things that we do, and this is really important wherever you go, is do not allow them to gyp you on your labs. Okay. It's not okay anymore just to do a TSH. It's not okay just to do an FSH. We need to look at entire portfolio. We need to look at your metabolic and inflammatory health. We need to look at all your hormones. We need to look at your thyroid, not just a TSH. We need to look at all your nutrients, all your minerals, your body composition. How healthy are you? How do we protect your heart? And so one of the ways that we do that with our 360 diagnostic is we really break it down by markers. So we first look at the metabolic and inflammatory markers. Some of those may be homocysteine that we look at, high levels of ferritin, a C-reactive protein. These are all markers that are showing us if there's oxidative stress and if there's inflammation. We look at your hormones and your adrenals. So we're going to look at your DHEAs, your adrenals working okay. We look at your cortisol for your stress levels. Then we're still going to look at your free and total testosterone, your estrogen, your progesterone, your DHEA. Those are so important. And then thyroid function, again, not just your TSH. You need to look at your free T3 and free T4. Your free T3 is what is your active thyroid. It's what's going to bind to your receptors. So if you're only on Synthroid and you're only on T4, you still may feel a little lousy because you're not converting by yourself. And so you need a little bit of support. Looking at your nutrients and minerals, what is your iron doing? What is your folate? What is your B12? What is your vitamin D? Vitamin D to me is one of the most important vitamins. It's actually acts like a hormone, and studies have shown it's the most important thing to improve mortality of life. So even during COVID, you were more risk to die from COVID if you had a vitamin D level of less than 40. So if you were actually admitted to the hospital during COVID, they gave you a vitamin D injection. Yet nobody was told is double your vitamin D, let's optimize. And so it's really important when we look at these labs and they say 30 to 100, we're trying to get to that 75, 80 mark. We don't want to feel like we're 100. We want to feel optimized. We need to make sure that we're getting not that 30, that's the lowest level before they say you're really, really deficient. Optimizing your level is so important, and we go over that. And then the Sika and EKG and comprehensive panels, these are all important. Is how are we going to help you out? Because as women, we only look at pinchable fat. What we need to understand is that women don't take enough protein and we don't have enough muscle. That muscle is what's going to burn our fat. And we need to look at the visceral fat. That visceral fat is your internal fat that surrounds your organs. And when that increases, you're going to start to notice that you're going to have increased insulin resistance and diabetes and heart disease. So we need to look at that visceral fat and compare that and follow that along during your journey to make sure that we're doing the right thing. The comprehensive questions really understands your lifestyle, your stress, what can you do to change, right? I always tell people it's much easier for me to do injections and make you look beautiful, but it's really hard to make you feel good because this is a partnership. you must put in the work also. You cannot live at McDonald's every day. You need to not live on sugar all the time. We're going to help you. How do you improve that muscle? How much protein are you going to have? How are we going to decrease our risk factors? So this is something we really work for you. And then the Visio skin analysis we do to kind of help you look at what are the signs of aging and how can we improve them aesthetically. And the 360 makes the progress measurable. So we can measure this, follow your progress, just like we follow your laboratory tests. We're going to follow this to make sure that you are going down the right track and that we need to improve your symptoms. And then, so my final message is going to be that hormones don't make you sick. Hormone deficiency makes you sick. You need to get properly evaluated. Okay. Request that, demand that. Look at your symptoms in your labs. Look at your dosing. Not everyone is the same. Nobody has the same dosing, right? We're all different and depending on what cycle we're on. The timing when you start matters, and then your form. So you'll be able to really have a consultation when you're ready to look at what's my best modality and where am I going to do the best to get better. So if you've ever been afraid, this is your opportunity to ask questions for your hormones. We also had some questions that you can answer because that's going to really be important is where you are in your journey. How ready are you? And what are you willing to risk if you don't treat your hormones? I want you to be safe. I want you to be healthy. Please make sure you take care of yourself. Whichever route you do, always educate yourself and don't be fearful anymore.
Thank you,
Thank
Doc.
you.
So everybody, we have the questions up. We just have two for now. If you don't mind taking a few minutes to answer. And then Doc, I think we did have some questions submitted to you. If
Okay.
any of the other attendees would like to submit a question to Dr. Suarez, on the bottom of your screen to the left-hand side, there is a Q&A button. Feel free to click the button and type in your question, and we will be able to get to it. I know we're running just a bit over time, but no worries here. So Doc, you can see some of the answers coming in.
I see the answers. I'm looking for the questions. Oh, okay.
So you see the first question is, where are you in your hormone journey? We have some answers: postmenopause, premenopause. I'm not sure. So we'll be able to help you figure out where you are in your journey.
Okay. Oh, these are for the polls.
Yep, the polls. And then which symptoms are you affecting you the most right now? We're getting a lot of fatigue, low energy, weight gains are popular one, poor sleep is another, mood swings. Those are the most popular right now, but seems like all of them are pretty relevant.
I
Thank
agree.
you,
And
guys.
that's very common. You really have a little bit of everything, but it's really depending on where you are in your journey that you feel the most problematic.
Perfect. And let's go on to some more questions. Give me 1 second. And here is some more questions. So after today, how do you feel about BHRT after our presentation? Let us know how we did. Which form of BHRT interests you the most? And would you like a personalized hormone evaluation? Is that something that we can help you with? So I do see some questions being answered. I'll give you guys a few minutes to answer that. And then Doc, I can pull up the questions you had submitted directly. So the first one is, how long can you stay on hormones, specifically pellets? Is there an age where I should stop? I'm 68, still on them, and still getting great benefits.
Yeah, I agree. There really is no time to stop. Pellets are interesting. I love pellets, but they're not great for everyone, but they're so convenient and they give you the best levels. And once you're on a pellet, you really want to stay on the pellet. Once you come off, you don't feel that great anymore because it does give you a little bit more of a higher dose and you feel amazing. You feel empowered. There's nothing better than the clarity that you get with a pellet. So they say it's for prevention of heart disease and prevention of bones. You can stay on it forever.
Great, thank you. If you have a follow-up question, don't hesitate to ask. Here's another one. How about us who've had a hysterectomy?
Yes, that is a great question. We have so many young people, 30s, 40s, having hysterectomy. Now, most of the time, your ovaries will produce hormones for a while, but we've noticed that most of them really start to diminish very quickly afterwards, and they should be supported. So once you have your laboratory test done, You can see, is it your estrogen, your progesterone, your testosterone that's low? And then you support it. And that was really, we still kind of have this argument about progesterone. Like we talked about earlier, the old frame of thought when we were in school was if you don't have a uterus, you don't need progesterone. But we already showed you that progesterone has to do with multiple parts in our body. We're not just protecting our uterus, we're protecting our breasts, we're protecting our bones, and we're protecting our brain. So during a hysterectomy, you still need all three hormones to support the body.
Great. Thank you, Doc. What are the pros and cons or differences between pellets and bioidentical?
So for us, I normally will do the creams either when they're in their 70s already and they just want a little bit of improvement to kind of help with the symptoms. I'm not trying to really reverse a lot of damage that has been done. Um, I love injections and pellets. I'm personally on injections. They're very easy and convenient, but they are a little tiny sub-Q injection in the abdomen that you do once a week. You get a really good level and you can kind of control that systematically. And then pellets are amazing because they're very bioidentical and they're very easy. So people that are traveling a lot, that are working a lot, that need more of a hormone push, you only have to get pelleted every 3 to 4 months. So it's a super easy, really easy platform, and you'll get a nice homogeneous curve. So you'll start to go up. And normally within 4 weeks of a pellet, you feel amazing. And then it'll kind of keep going and then it'll start to plateau at around 3 to 4 months and then you get repelleted. So all of them are really great. So I look at it, it's really about where you are in your journey. How quickly do you want to get there? I know a lot of people are afraid. And so if they're super paranoid, I don't start with a pellet because you can't remove them. But I will say, once you get on a pellet, it's really hard to get anybody to transfer to any of the other ones because you don't feel as great with the cream. Your levels stay really, really low. And so it's just kind of just helping that top part of the symptoms.
Great. Thank you. We have a few more. What brand of vitamin C do you recommend? I need to know exactly what to get because there are too many to choose from, which
There
I get
really
that.
are. There truly are. And so, honestly, you really, for all vitamins, you just need to look at a medical brand. There was a study that showed that over-the-counter vitamins, 70% were deficient in what they said they had in that vitamin. And most of them, particularly B vitamins, are not methylated over the counter, which means you're not absorbing them. So you may be drinking them and you're peeing them out, but you're not absorbing them. So make sure it's a medical brand. We use multiple medical brands at my office. And so as long as you have a medical brand, you know that they have to be tested and they have to be approved to show that what they say on the label is actually there and that you're able to actually absorb them.
Makes sense. Thanks, Doc. Here's another one. If your DHEA is high, is it good to have testosterone?
So if your DHEA is high, but your testosterone is low, then yes. Now, typically DHEA will support you from making testosterone, but DHEA comes from our adrenals. So you could be having a lot of issues with your adrenals and your cortisol levels, and you could be under high stress. And so that might be pushing your DHEA up, but that does help you make some. So if you can imagine, if your DHEA is up, your testosterone should relatively be good, right? Because it's going to help support it. And if it's low, that means that's being pushed probably from more of your cortisol and adrenals.
Perfect. I have a follow up to the hysterectomy question. She clarified that she had a full hysterectomy, no ovaries. How does that change anything?
That means you should be put on bioidentical hormones. As soon as they do that, they should automatically put them on because you
Okay.
have no more hormones. You didn't make any, so you need to replace that.
What about if you have an IUD?
So IUDs, so there's some that have hormones and there's some that don't. And so an IUD is a little bit, especially without the hormones, a lot safer than for me for than using birth control. So you still can be placed on bioidentical hormones with an IUD. The IUD is really about helping you not get pregnant. Now, if there's hormones on that, depending on how long it's been in there, a lot of times I will start to get them off of there. Just like if they're in birth control, I wean them off their birth control. If they're in IUDs, whether it's 5 years or 10 years, we'll start to have them come off. But you can still replace some of those hormones because right now, remember with birth control, you're blocking it. IUD, you may be still blocking those receptors if you are on hormones. So giving a little bit of hormone balance so that you don't completely have all those side effects is still really important.
Great. Another one. What about if you've never had kids? How does that change the protocol?
It does not. You will still go through your normal cycles. You're going to go through perimenopause. You're going to go through menopause. Everybody will. Now, the risks with, not having children, you have to look at there's different risks for breast cancers. And so you always want to make sure that you're always getting everything checked. But no matter what, all of us are going to go through menopause. If we live long enough, we're going to go through menopause. Our body is made to shut down. Our ovaries stop to produce. Our brain stops producing that. But we now live longer than ever and we're more youthful than ever. So we know that keeping those in, this was always interesting to me. If your thyroid diminishes as we age, right? Our thyroid doesn't work that well. Nobody has a problem if your thyroid stops working to give you a thyroid medication and replace it. It's a hormone. But if your testosterone goes down, everybody has a problem giving you another hormone to replace that. We replace what goes down as we age so that we can improve our symptoms.
Thank you. Isn't it better to bypass the liver and do patches? I believe this is in reference to the pellets.
Yeah, so all of it bypasses the liver except for oral. That is why no hormones other than progesterone should ever be taken orally. There are plenty, that's why birth control is oral, but nothing. Your doctor should never give you oral testosterone. You have to have such high doses to go through your liver and get processed to be able to absorb because your liver is going to detox 70% of what you're putting in there. And you're going to actually injure your liver by taking everything orally. The only safe hormone to take orally is progesterone. It has been shown to be safe. It's safe in pregnant women. It's safe in everyone. And why we take it orally, only oral can actually penetrate the CNS and the brain barrier so that it can help with calmness, anxiety, and sleep.
Great. Any thoughts on patches specifically?
So with most of my patients who have come in, I've never prescribed them. We've never seen our patients with good results. When I test them, they still don't have any hormones in their blood most of the time, and they don't feel well. And so I've tried different things. I've tried keeping them on patches. I've tried adding to their patches, and then most of the time we end up having to take them off their patches and just restart with either creams or injections or pellets, and so that they just don't really feel those symptoms. And there is no testosterone in patches. And as you know, that is my favorite drug, right? We're all complaining a lot of those comments where I can't stand the weight gain, the side gain, the abdomen gain, I'm exhausted, I'm fatigued, I'm foggy. That's testosterone, and you can't get that in a patch.
Got it. Thank you for clarifying. Another question. Why is it not good for women over 60 to do BHRT?
Oh, it absolutely is great. What they're saying is, in order to prevent disease, like if I'm trying to prevent you from having a heart attack or osteoporosis, the earlier that we can do it, if we can catch it within the first 10 years of menopause, then we're actually going to prevent more disease. We're still going to help you support your bone. We're still going to help with the brain fog. We're still going to help with everything else. It's just for us to really help prevent high cholesterol, high blood pressure, right? We need to catch it before it starts. We can improve it once you have it. But again, we're really trying to prevent disease.
I recently started HRT, but my provider did not offer testosterone. Are there risks or other cons to consider?
No, again, testosterone is my favorite. The only side effect I really have seen with testosterone, and you have to start at lower doses if you have acne. You don't want to have higher doses because testosterone can make you a little bit more oily and it makes your skin more plump, but that can cause a little bit more acne if you're prone. So you just start at a lower dose. We were laughing earlier. Someone had asked me about, am I going to sound like a man? No, you don't get voice changes. Remember that a woman's testosterone level may be around 80 to 150. A man's testosterone is 1,000. So we are never trying to get to what they have. We're perfectly well with our small amount of testosterone because we're still more energetic and smarter.
Love it. Does the diagnostics test for prolactin levels? I have had problems pre-children with 3 times the normal limit. It was causing me fertility problems.
Yes. And we do check the prolactin, right? Because again, we're looking at the whole entire axis. We're looking at the pituitary, the hypothalamus, and the ovary. We're looking to see where's the deviation in that axis. So whether it's infertility or whether it's PCOS, that all kind of shows up in our lab and we can look at. Now, if you've truly had elevated prolactins for a long period of time, at some point you should have had an MRI to look at our pituitary to make sure there was no mass that was causing that prolactin. But after that, once that is cleared, then we can really try to fix that HPO axis.
Great, thank you. What form of medication is covered through Medicare?
Medicare. Well, I would say in all insurance, I don't know so much for Medicare, but in all insurances, the only one that they mostly cover is progesterones. A lot of them will cover. It is not normally micronized. It's called immediate release. So the difference is immediate release progesterone that you can get at CVS or Walmart or any of the pharmacies will help you calm down and help you fall asleep, but it doesn't help with the mind chatter at night. So that 2, 3 o'clock in the morning, waking up is normally have to be micronized compounded progesterone. And when we compound that, that helps you fall asleep and then stay asleep. So that one could be covered if it's just immediate release. Testosterone is never covered in women. And estrogen, the only ones I really have seen covered is the estradiol patches, but that's about all I've seen covered. They don't cover injections. Sometimes you can get creams depending on the dosage and depending on but most of them are done from compounded pharmacies.
Great, thank you. Last question. If anyone else has any questions or follow-up, please submit them now. This is a follow-up question to the patch question. Is testosterone better through an injection then? Some people have had very bad experiences with pellets.
Yeah. So the problem with pellets is if you go too high. So if you can imagine, I always call the pellets from 0 to 100, right? So if you come in and you have zero hormones, and then we fully replace you in 3 months, it is a big shift in your body. And so some people can feel some swelling, some bloating, especially if you overdose. When you do a pellet, you really are supposed to start at a lower dose and then your next pellet go up a little bit more and then go a little bit more until you get to that 100. But going from a 0 to 100 is where people are going to have that problematic. And so it's really just dosing them correctly so they don't have those issues. And then one quick thing, because I think this was our last question, was I think the importance with insurance and understanding why it's not covered. If you can imagine, big pharma is what controls our insurance and what's covered. Big pharma cannot charge for something that is bioidentical and made from like yam. They can't produce that. It's not birth control. It's not a pill that they can sell. And so they're the ones that lobby for things to be paid by your insurance. So hopefully in the future with these black label, boxes being removed, but I just really don't see it in the next probably 5 to 10 years that our insurance is going to start to cover bioidentical hormones. It would be amazing. But I'm not going to hold my breath and let people not be treated because we're still waiting for insurance to cover it.
Great, thank you, Doc. I do have one or two more questions. What are the risks 4.5 years out of breast cancer diagnosis?
Yeah, that one is really tricky. And thank you for sharing that because that's really important. I'm also 4.5 years out, and so those are really amazing. I work very closely with my oncologist. I have been on testosterone now for the last 2 years, and I got a lot of pushback. And I pushed back. I showed her all the studies in Europe, how they treat cancers with testosterone, how it decreases the risk of breast cancer, and how we're doing harm by not putting women on. And so I've been on it now for 2 years. And depending if you're ER or PR positive, we really kind of work with women and their oncologists. Typically, it's for the first 4 to 5 years that you can't be on at least estrogen or progesterone, depending if you're positive for that. If you're not positive, it's a little bit high, you can go back on progesterone. But typically, testosterone is very safe to go back on.
Great, thank you. I like this question a lot. How do you determine when HRT is the right next step versus starting with lifestyle, nutrition, or peptide support first?
It's all of it. So when we examine you and we go through the Sika evaluation and we do the lab test, we systematically get there. So if you're borderline and if you're borderline in your hormones, but you're not well, then I'm going to optimize you well. I'm going to optimize your vitamin D and your B12 and your folate and get you on good support and get your protein up and get all your macronutrients up, right? We want to optimize who you are and then reinvest. It's stepwise fashion. If you throw everything at someone, then we don't know it works. I can't treat your thyroid and all your hormones and all your macronutrients at the same time many times because then I won't know. So we didn't get here overnight. And so a stepwise fashion and going slow is important to make sure that you feel well.
And then this one's very common too. I see this often. What are the ingredients in bioidentical hormone injections?
So it depends on where you're getting it. They're supposed to be very bioidentical. Most of them still have a small amount of preservatives in there. Even for men, there's grapeseed oil on them, there's sesame seed oil on other ones. So depending on how they compounded, because they have to be in an oil base to be injected.
Great, Doc. Thank you so much to everyone who asked us a question. I know we enjoyed answering those with you. And before we end this call, I do want to remind everybody that there's a $100 off offer on our 360 diagnostics evaluation. So you saw Dr. Suarez go a bit into what that entails and all the biomarkers. So everybody who did RSVP to this webinar will be getting $100 off their evaluation and also a free injection. Doc, if you want to speak a bit to that.
Yeah, it's one of my favorites. So it's a fit shot or lipoline if some people know about it. So it just improves our metabolism. It helps with liver detox and helps with energy. And who doesn't want all of those three? So you just have
Great.
to
Yep.
come in and schedule, and we'll be happy to do that for you.
Exactly. Wesley Chapel or West Chase location, either one. Thank you, guys. Anything else, Doc, before we hang up?
No, thank you all for listening, and I really hope this is helpful. And bless you in your new journey.
Thank you so much, everybody. Have a great rest of your night.
Thanks.
Bye.